introducing Dr. Candido Rivera. He's Assistant Professor of Medicine in the Hematology Department. He's a Fellow of the American College of Physicians. He specializes mostly in anemia, of course all hematology, but anemia and myeloproliferative disorders. He's got 2 talks for us, one on anemia and one on coagulopathies. Dr. Rivera.
Good morning. Oh, that was a wonderful talk. I'm not going to show you that much data today. I'm just going to show you a few pointers that I find very useful in my practice, and I'm going to share them with you in the perspective of a hematologist, and hopefully you'll get some pointers that will help you out in your daily practice. So, the first step of evaluation of an anemia patient, you have to figure out if the patient is actually anemic because he's destroying or losing blood, or if he's just not making it. So the way we figure out is that we get our CBC and we notice that our patient is anemic. And the first thing that I tell my fellows is that whenever you have an anemic patient, you need a retic count. If it was up to me, a retic count will be on all CBCs. And I'm going to tell you why. And once I tell you, you're going to appreciate a little bit more. You probably know this, but you never thought about this. So an absolute retic count of 60,000, it's the amount that you need to maintain your hemoglobin at a steady state, provided that there's no hemolysis or bleeding. So let's start thinking about this for a second. Let's say that you have a patient that has a hemoglobin of 8, and you have an absolute retic count of 60,000. Well, this patient has an inappropriately normal absolute retic count. And if his retic count absolute stays at 60,000, that hemoglobin is going to stay at 8. It's not going to increase. Now, I often quiz the fellows and I tell them, okay, so let's say that I have the same patient with a hemoglobin of 8, and his retic count is 600,000. Well, we're going to do some math this morning now. So blood is made or recycled every 120 days. So if the 60,000 is what you need to maintain, and we have a patient that a hemoglobin is 8 and he's making an absolute retic count of 600,000, that means it's tenfold the regular amount.